Perfect. Thank you. Thank you everyone for joining the presentation today. So we'll go through some changes that is associated with dementia. Perfect. So we'll just go on to the next slide. Yeah. So first, a little bit about Empower Healthcare. So Empower is a multidisciplinary team offering allied health services in community nationwide. And we do in-person services as well as telehealth. So if you're interested in any of our services for a client, please contact our office, and we provide telehealth services for dietetics, OT, physio, and speech pathology. Perfect. Um, Perfect. So today I'm going to go through a bit of an introduction. I'm going to do a quiz on some myths and some facts regarding dementia. We'll define what dementia is and how it affects the brain. We'll also go through the prevalence of dementia here in Australia, some of the symptoms that people may experience, and I will also provide some information specifically for carers for people living with dementia. And then there'll be time at the end to do a bit of any Q&A. So if there's any questions anyone has, if you just want to keep them until the end. Okay, so I'll just do a bit of an introduction. So my name is Emma. I'm an occupational therapist. I've worked with a lot of people living with dementia, both in hospital setting and in their own home environments. So today I will be kind of going through some things that I have found that is quite helpful for people living with dementia, and also how I've helped to support the people that are caring for those family members that are living with dementia. So occupational therapists support people with promoting health and well-being by enabling them to participate in their everyday activities. So for people with living with dementia, OT support them to optimize what someone can do. They do this by increasing their participation in meaningful activities, enhancing their quality of life, and they also support safety and independence. Okay. So we're gonna do a bit of a quiz. We've never done this before, so just bear with us in case there's any technical difficulties. So basically there should be a bit of a poll, is that correct, Nicole? And yeah, perfect. So I'm just gonna ask the question, and I just want you guys to answer if you think it is a myth or a fact. Fine. So dementia is a normal part of aging. Do you guys think that is a myth or a fact? Okay, I'm gonna.
Hold on, I don't know if it's actually popping up. Let me
Oh,
see. Can you
yeah.
see it?
Yeah, I can see it.
Oh, okay. Oh, there you go. Yeah, people are voting. So they're going through
Okay,
voting.
perfect.
So can you
Okay.
see, you can see the results there?
Um, 1 second. Yeah. Yeah, I can see some of them. Yeah, perfect. Okay, so for that one, yeah, you're correct. That is a myth. Dementia is not a normal part of aging, and it can affect anyone, not all older people will develop dementia. So the second question is dementia and Alzheimer's disease are the same. Is this a myth or a fact? So if you guys want to vote for this question as well, just give you a few minutes. Okay, so this is also a myth. Yep, you guys are correct. So Alzheimer's disease is just one type of dementia, and it is the most common type. The next question is dementia is just being forgetful. Is this a myth or is it a fact? So Yep, you guys are correct. So, this is a myth. So, dementia is not just being forgetful. There is lots of changes associated with a diagnosis of dementia, and we will go through these in more detail throughout the presentation. Um, so the next one is cold showers can prevent dementia. Is this a myth or is it a fact? So yeah, this is correct as well. It is a myth. There's no evidence to support this. And then the last one, physical activity reduces the risk of dementia. Is this a myth or is it a fact?
This one had divided results. All the other ones everyone's been really good at, but this one,
Okay.
people are not quite sure on this one, so it'll be interesting.
Yeah, okay. So, yeah, physical activity appears to reduce brain aging and cognitive decline in people with mild cognitive impairments and dementia, but it isn't Um, and isn't loads of evidence to suggest this, so it's not a fact, but there is some evidence to support that it does help. So people getting out and about into their community, having social interaction is important for people living with dementia or older people. And then in turn that can prevent some cognitive decline in people, but it's not a complete fact. So it's kind of half and half. Fine, we'll go on. Thank you everyone for participating in that quiz. So we'll go on to the next slide, please. Um, Perfect. So defining dementia. So, what is dementia? So, dementia is a syndrome. It's usually of a chronic or progressive nature in which there is a deterioration in cognitive function, i.e., the ability to process thought beyond what might be expected from normal aging. And there is lots of different types of dementia. And the three kind of most common are vascular dementia, Alzheimer's disease, and Lewy body dementia. Fine, okay. So, how does dementia affect the brain? So, dementia is caused by damage to the brain cells, which are called neurons, that are responsible for cognitive functions such as thinking, memory, and decision making. The damage disrupts the way these cells communicate with each other, leading to the characteristic symptoms of dementia, such as memory loss and, and confusion. So, dementia does affect everyone uniquely, and it can affect your thinking, mood, and behavior, as well as your memory. And memory loss in dementia is different from sometimes just forgetting things. It is a persistent and progressive, not just occasional. And we'll just go on to the next slide. Perfect. So dementia can happen to anyone. It is more common in people over the age of 65. There are more than 421,000 people living with dementia in Australia, and 1.6 million Australians are involved in the care of someone living with dementia. There is treatments to manage many of the symptoms, which is both pharmacological and non-pharmacological, and we will go through some of these throughout the presentation. Perfect. So I'm just going to talk a bit more about the changes associated with dementia. So the main change that people associate with people living with dementia is that their memory is reduced or they're forgetting things. However, there is a lot more changes that are associated with dementia, which is often not talked about, meaning that these changes can be difficult for carers, family, and people living with dementia to navigate. So, as we've discussed, so memory is kind of one of the most common ones that people know about. So often that they're forgetting certain things, such as their appointments, they're forgetting to take their medication, if they've eaten a meal, that kind of thing. If you find that you're having to repeat yourself a lot of times for people living with dementia, then obviously orientation. So if they're not aware of the day of the week, the time of the day, or where they currently are. Um, Another kind of change would be reduced judgment and problem solving. So this can present in that they have a lot of difficulty with completing their daily activities. An example of this might be that if someone living with dementia is trying to prepare like a cup of tea, and they're trying to turn on the kettle, but nothing seems to be working, and they're not able to heat up their hot water. Maybe it is that the kettle isn't switched on at the wall, but because they have reduced like problem solving abilities, they're not able to problem solve that, oh, this might be not switched on at the wall, and that's why it's not heating up. Also, kind of some you can have some changes with like safety awareness, so they're a lot more kind of taking risks a lot more. A kind of classic example that you might see is that if someone living with dementia needs like a mobility aid, for example, they tend to always forget that they need to use this when they're walking to for their safety and to reduce their risk of falls. Yeah, so then another kind of one is that they might have some reduced social and community engagement. And this might be reduced interest in activities which they once enjoyed. And this can be due to the person is no longer able to complete these activities which they used to enjoy, or even going out and participating with their friends, or going into the community. Sometimes they might feel that they don't have the same kind of cognition or memory as they used to, so they feel like they don't want to meet their friends due to these changes. Personal care, so they might have reduced independence in their personal care, such as toileting, showering, getting dressed in the morning. They also might have some reduced physical capacity, so reduced mobility, balance, motor planning, and coordination, and then changed behaviors, which we'll go into more detail in the next slide. Okay, so change behaviors. So change behaviors means any behavior or mood that is distressing to the person with dementia or the people who love that person or care for that person. So change behavior can be expressed in many ways, such as hitting, screaming, restlessness, agitation, wandering, sexual disinhibition, depression, anxiety, hallucination, or hoarding. Um, and these these kind of change behaviors or changes in behavior and thinking, and they're expressed in these kind of different ways, and these symptoms present as problems or unmet needs for people with that are living with dementia. So, for example, if someone is in quite a lot of pain, but they're not able to kind of express that need to their carers, that can present in them kind of expressing these changed behaviors and becoming more agitated. And it's just difficult for the carers to kind of understand where these behaviors are coming from. And it's these behaviors that aren't often talked about for people living with dementia, and can be quite distressing and difficult for both the person and their family. Fine. And then just the next slide. So there is lots of non-pharmacological interventions that can help support the person living with dementia. And this is a lot of the kind of the work that an occupational therapist will do with the person. So first of all is establishing a good routine. So it's very important to have consistency with the daily routine. So trying to make sure that if they're getting support in every week, that it is kind of at the same day and same time, um, so that they're not kind of getting confused, and they know what their daily week or their week looks like. Having like breakfast at the same time every morning, lunch and dinner. That they when they have their showers, that kind of thing. Just having a consistent routine is really important. And another way is like having a calendar that they can visually see, and if there is any changes in their week, like they have an appointment or anything like that, that can be clearly seen by them, and they are aware what to expect in the week. So maintaining engagement in meaningful activities. So this is really important for all older adults, especially those living with dementia. Um, it is important to maintain independence in tasks. For example, if they can do some aspects of the task, it is really important to allow them to complete this to support their choice and control, and their engagement in their meaningful activities. And I will go into more detail with this in the next slide. Um, um, and also, it's important to do some kind of cognitive training. So, engaging in activities which stimulate the brain, such as puzzles or reading. Try not to allow them, like, don't, it's not good if they're sitting in front of the TV all day because that's not stimulating any brain activity. Um, Make sure to adapt the environment to ensure that it is dementia friendly, and encouraging physical activity daily so they're not just kind of sitting down in the chair or in bed all day. So yeah, the next slide. So what OTs can do to support. So as I said, OTs can complete a full assessment to establish what the person and their families are struggling with in their daily lives and what supports strategies can be implemented to maintain their independence and participation in their meaningful activities. Um, so this can be completed through modifying activities, prescribing assistive technology, or modifying the home environment. So for the next slide, so the modifying activities. So this can focus on what the person can still do and allows them to participate in their meaningful activities. So some kind of tips to help do this is to match the activity to the current ability and interest. Um, so choose activities based on the person's strengths, their interests, and their remaining skills. Avoid activities that are too challenging or too simple for the person. So it's important to kind of have a conversation with the person living with dementia. What do they used to really enjoy doing throughout their lives? And then that's kind of an activity which would be good to choose. And then you can make it easier for them, um, so that it's not too challenging and they still will be engaged in it. You don't want to make it too simple, as I said, because then they might just get bored of it and it's not stimulating enough for them. So simplify the steps as well is important. So make sure that you are breaking the activities into small, clear steps and offer demonstrations as needed, such as verbal, visual, or hand over hand demonstrations. And it's important to allow extra time for the person, so don't rush them or correct them. It's not about perfecting the task or anything like that. It's just basically about getting them to engage in this activity, maintaining some of their independence in it. That's the most important thing. So an example of like how to modify an activity would be, so if the person really used to enjoy cooking, but because of their dementia, they're not able to do it as well as they once used to do. So a way to kind of maybe modify that activity is making sure like all the required items for the task is set up for the person. So when, yeah, they have everything out on the countertop, so they're not trying to find things, which might cause a bit of confusion. Or if they will struggle still with that, you could get them to just chop up some vegetables, which is still participating in the task, but it's not doing the full task, which is still maintaining some independence. And yeah, don't focus on how well the person is doing the activity, as I mentioned. It's just important that they are still maintaining some independence in the task. So then assistive technology, equipment, prescription can increase the person's participation in their meaningful activities, and the OT may recommend equipment to increase the person's participation. So some equipment can range from calendar clocks. So if the person doesn't know the day of the week and what time it is, the month, they can be really helpful. Medication boxes, so pill box reminders. So if they're frequently forgetting to take their medication, there's alarm pillbox reminders that will alert them that it's time to take their medication. You can also get like GPS watches For example, if the person tends to wander and leave their house so that their family members can locate them. You can also support a person living with dementia by reducing the risk of falls and accidents around the home, supporting their independence and choice, and reducing premature entry into residential care. Yep, and then this the next slide. So it is important for people living with dementia to be in familiar surroundings, and there is a lot of importance placed on their home environment. However, not everyone's home will provide an optimum supportive environment, and some changes may need to be made to improve function and quality of life for people living with dementia. And this is kind of where home modifications might come in. And these are changes that are made to the home to enhance the person's safety, independence, and quality of life. And they aim to improve their independence and confidence in activities of daily living, such as eating, dressing, showering, and meal preparation. And they aim to allow the person living with dementia to live independently for longer. And these home modifications might be simple changes, such as like a grab rail in the shower to help them get in and out of the shower, or it actually might be very simple changes which anyone can kind of do, such as providing like visual aids throughout the home. For example, just if the person struggles to find like their mugs or their plates within their kitchen, doing some simple visual aids that can be stuck to outside the cupboards that says that has a picture of a cup and says cup so that they can easily find where everything is located. That's a very simple way of making the home environment better and more suitable for a person living with dementia. Okay. And then, so caring for people living with dementia. So just on to the next slide. Yeah. So dementia is a complex progressive disease which can be very difficult to navigate. And to ensure people are living with dementia, sorry, navigate and to ensure that you're supporting and enabling the person living with dementia to live well. There are lots of resources and support out there to support carers to navigate the changes associated with dementia. For example, we have the National Dementia Helpline, which provides free and confidential support. It provides expert information, advice, and support 24/7, 365 days a year. And also, Dementia Australia is a really helpful resource as well. It has lots of information on how to care for people living with dementia. It has like different informations about how to adapt the home environment, and it also offers free counselling sessions for carers living with dementia. Fine. And then other supports to consider. So the occupational therapist may also work in collaboration with other healthcare professionals that can support a person living with dementia and their family. So, for example, improving communication, maintaining social or a speech pathologist, sorry, can support to improve communication, maintaining social engagement, and ensuring safe swallowing as cognitive abilities decline. And then a dietitian can help by optimizing nutrition to improve quality of life, managing weight loss, addressing swallowing difficulties, and creating enjoyable, accessible meal routines. And as part of Empower Healthcare, we also offer a program which is called the COPE Dementia Program. Um, this is so COPE stands for Care of Older People with Dementia in Their Environment. And this COPE program is a time limited, tailor made support program to support individuals with dementia living at home and their caregivers. Yep, so if anyone's interested, you can always reach out to Empower. Yep. And then just to conclude, caring for someone with dementia can be challenging, but with patience, understanding, and the right strategies, carers can help navigate these changes more effectively, by fostering empathy, maintaining routines, and seeking support. Both the person with dementia and their carer can experience a better quality of life. So thank you guys for your time and engagement today. This webinar is part of our Living Well with Dementia webinar series. And our next webinar is on Wednesday, the 25th of March at 12:30 p.m. Australian Eastern Time. And this will be on connecting through communication. And this will be the last webinar in the season or in the series. Perfect. Thank you. If anyone has any questions, you can just pop them in the question box, or if you guys want to try and ask them in person.
You've come off video, Emma. Oh no, there
Oh,
you are.
yeah.
There,
Hi.
there you are. There's a question in the chat. Can you see that, or do you want me to?
Oh, yeah, I can see it. Yeah. So the
There you
question is,
are.
when you say cope, is it time limited and how long does it run for? Yeah. So it is a time limited program, and I believe it can run for it's kind of 12. I think it is about 12 sessions. So it depends how long those, it can be over 12 weeks, or sometimes the sessions are spread out over a couple of weeks. But it is 12 kind of OT sessions altogether, and it is working with the family and the caregivers to kind of help navigate those changes that have been associated with dementia. And a lot of it is to kind of increase participation and engagement with their meaningful activities. And then we have another question. Do you have specific recommendations for calendar clocks? No, not really. It depend. It kind of depends on the person. So, well, a lot of the calendar clocks are quite good, and they'll be quite big, and they'll have the time in quite big letters and the day in quite big letters, which is, I think, would be a good type of one to get, because it'll be clearly seen by a person, and if especially with older people, if there's any like visual impairments, it'll be easy for them to see. But yeah, most of them are quite standard. So as long as they have like the day, the week, the time, month, and year, um, they're pretty good. Some of them you can also get as well that have like reminders, so to send reminders to the person to that about an appointment and that kind of thing. But yeah. Um, so another question is, how can OT be delivered by telehealth? So it really depends on what the reason for the OT referral is. If it is things like providing education on for example, some of the things that I spoke about today, that can definitely be developed through telehealth. But if it is for things like prescribing assistive technology, which is quite high risk and high cost, it would be recommended that and it would be, yeah, it would be recommended that an occupational therapist would perform like an in-person assessment. But for things that maybe are kind of low cost, such as like providing that like calendar clock, um, or those type of assistive technologies, that can definitely be delivered through telehealth. So it just really depends on what the referral reason is for. Does anyone have any other questions?